everyone. Welcome to Chapter 7. In Chapter 7, we're going to be physically talking about the skeleton. Last chapter, we talked about bone tissue and sort of what it's made up of. Now, this chapter, when I lecture, is going to be very different, and so is the next chapter, because these a lot are just things that you've got to go in and memorize or, and study. So I can't really, lecture on the names of each bone and stuff like that, because that's something that you're going to have to work on and memorize. But I'm going to go through and just summarize what you need to look at. So this is going to be a very different lecture from what you're used to in the past. I can't lecture over every slide. So I'll skip through a lot and just kind of cover a little bit that can be covered. So the skeletal system, or the skeleton, again, we talked in the last chapter, composed of bone, cartilage, joints, and ligaments. The skeletal system is mostly bone, but there is cartilage in isolated areas, and of course the ligaments connect the bones and reinforce joints. The skeleton does account for about 20% of the body mass, and like we talked in the last chapter, there are two major divisions, the axial skeleton and the appendicular skeleton. The axial skeleton consists of 80 bones divided into three major regions, the skull, the vertebral column, and the thoracic cage. And of course, the axial skeleton has three functions. They form the longitudinal axis of the body, they support the head, neck, and trunk, and they protect the brain, spinal cord, and the thoracic organs. So again, this of course is basically the human skeleton, but really talking about this what we're talking about, the axial skeleton here. So the axial skeleton and sort of what it covers there. And that's the back version of that. So the skull, of course, is the most complex bony structure in the body. It does form by two sets of bones, the cranial bones, which is cranium enclosed by the brain, and the cranial cavity. And it provides sites of attachment for the head and neck muscles. There's also facial bones, and that forms the framework of the face, contains cavities for special sense organs, for sight, taste, and smell. It provides opening for air and food passages. It secures the teeth, holds those in there, anchors them, anchors facial muscles for facial expression. And so most skull bones in general are flat and firmly locked together, except for the mandible, which you'll see as you start learning about those. And the joints are actually called sutures, and they have serrated, sort of sawtooth appearance. So here's the skull and the bones of the cranium. You see these suture lines. They look like that saw-like edges. They are the joints, but we call them sutures. And there's different sutures here, the coronal suture, the squamous suture, and the lamboid suture. You do need to know each of these sutures, so do make sure to memorize those. And these, of course, are those facial bones. Facial bones form the anterior aspect, with the cranium forming the rest of the skull. So the cranium is divided into the vault and a base. So the cranial vault, or the calvaria, forms the superior, lateral, and posterior portion of the skull, as well as the forehead. And the cranial base forms the inferior aspect of the skull. So internally, the base is divided into three steps, or what we call foci, anterior, middle, and posterior foci. The brain sits within these foci, which is enclosed by the cranial vault, and the area is referred to as the cranial cavity. And so you can see here, that's what you need to memorize of the stuff that I just talked about. So the posterior cranial fossa, the middle cranial fossa, and the anterior cranial fossa. Here we have a different view of that. So one thing that you have to be careful is you do have to memorize these structures from different views. So make sure you understand them from the superior view and the lateral view. The cranium also consists of other cavities as well, the middle and internal ear cavities, the nasal cavity, and the orbit that house the eyeballs. The skull has 85 named openings. So that's a lot, right? The foramina, the canals, and the fissures, they do provide passageways for spinal cord, the major blood vessels, and the 12 cranial nerves, which you get to learn later. So the major cavities of the skull, you can see those. So make sure that you understand each of those cavities. And this, of course, is that frontal section of that. The cranium is composed of 8 cranial bones, the frontal bone, the parietal bone, 2, left and right, the occipital bone, the temporal bones, there's 2, left and right, the sphenoid bone, and the ethmoid bone. So you can see this is anterior and posterior views that you're going to see here of that skull. So making sure you understand each part of this. And really it just requires sort of that memorization of each of these places, which other than kind of showing you these of what you need to know, you just have to sit down and kind of learn. So here's each of those things like the ethmoid bone and each plate that's associated in gall and each of those. So you're kind of seeing what you're viewing there. Again, this is looking at the base of that cranial cavity, superior view of the skull. So you can take a look and sort of try to memorize or at least know the locations of each of those. Again, these are the bones of the cranium and those sutures. You've seen this image before, but just kind of reviewing that. This is sort of that anterior and posterior views of the skull that you saw. We saw the front of it just a minute ago. Here's this one. So you see what that looks like towards the back as well. Bones are the lateral aspect of the skull. So we're going to have an external view and then in a second an internal view. So making sure that you understand each of those bones and sutures through each of those. And then, of course, here's what it looks like in the actual image versus the cartoon image you saw just a second ago. Internal view of that and what each area looks like. So making sure not only that you know the external view, but also understand and be able to locate things on the internal view as well. And of course, this is, you saw this image just a second ago, but making sure you understand those. This is the inferior aspect of the skull with the mandible removed. So that bottom piece that would go here is gone, so that you can look and understand each one of those pieces that are there. And of course, this is with the actual skull as opposed to the cartoon image. Again, kind of looking at that external view of the lateral aspect of the skull. Again, we've seen that already, but making sure that you are understanding where each of those things are located if you're asked to label something. This is the temporal bone, so looking at the bone structure here, seeing those different processes and fossa that are part of that, knowing each of these structures and markings are really important too. Of course, this is looking at that inferior aspect again. You've seen this before, mandible removed, but reviewing that. Again, the base of the cranial cavity here, what view you're looking at, making sure that you understand each of these bones here. The sphenoid bone, of course, you can see what part of the skull you're seeing it from, and each of those different markings and features that are associated with that. The ethmoid bone as well, you can kind of see where that's located, knowing each of the markings and features of that bone too. I know this seems like a lot that we're going through, but basically as you sit down and learn them, a lot of these images are repeating images, so don't let that overwhelm you either. So again, you've seen these images, making sure that you understand each of those. And all the sutures, remembering each of those. The facial bones, of course, it's made up of 14 bones, 12 of which are paired. The mandible and the vomer are single. So you have the mandle, the maxillary bones, there are 2 of those. The zygomatic bones, 2 of those. The nasal bones, 2 of those. The lacrimal bones, 2. The palatine bones, 2. The vomer and the inferior nasal conchae, 2. So the mandible is the largest, strongest bone of the face. It's this U-shaped lower jawbone made up of a body, which is the chin, and the 2 upright rami. The mandibular angle is the point where the rami and the chin meet. And the coronoid process is basically superior end of the rami, and it serves as an insertion point for the large temporalis muscle. The condylar process is posterior to the coronoid, and it forms this temporomandibular joint, and it has a mandibular notch which separates those processes. The body consists of an alveolar process that contains sockets for the teeth and the mandibular symphysis ridge. And the foramina includes the mandibular for the nerves and the mental foramina, which is the nerves and the blood vessels. And so you can see this is the anatomy of that mandible, so making sure that you understand each of that anatomy. So sitting down and memorizing this structure is very important. The maxillary bones, or the maxillae, is these medially fused to form this upper jaw and central facial skeleton. Upper teeth is held in the alveolar process. The anterior nasal spine forms just below the nose. The palatine process forms 2/3 of the hard plate. The frontal process forms a lateral bridge of the nose. And the zygomatic processes articulate with the zygomatic bones. And then we have maxillary sinuses that flank the nasal cavity laterally. The openings for nerves and blood vessels includes the inferior orbital fissure, the intraorbital foramen, and the incisive fossa and canal. And so you can kind of see that looking some of this in this image. This is the maxilla, the right lateral view. And so you can see this intraorbital foramen, the anterior nasal spine, and these processes where these teeth are. The articulates in the frontal bone and that frontal bone process that you can see there. And again, we've seen those. Other facial bones, the zygomatic bones, they form the cheekbones and the infralateral margins of orbits. They articulate with the zygomatic processes of the temporal, frontal, and the maxillary bones. The nasal bones, they form the bridge of the nose, and they articulate with the frontal, maxillary, and ethmoid bones, and they attach to cartilage that forms the tip of the nose. And then, of course, you have the lateral bones that form medial walls of the orbits. They articulate with frontal, maxillary, and ethmoid bones, and the lacrimal fascia that houses the lacrimal sac that allows the passageway for tears to kind of drain or move out. Again, you've seen those images before. The palatine bones are these L-shaped bones made of two bony plates, the horizontal plate that completes the posterior 1/3 of the heart plate, and the perpendicular plate that forms the posterior lateral walls of the nasal cavity. And then I mentioned the vomer before. This is the plow-shaped bone that forms the nasal septum. So you can see here, these are all those bones we just mentioned in those slides with words, seen together with the nasal cavity here. So making sure that you understand each one of these processes and markings and things within that nasal cavity. Also have the inferior nasal conchae. Those are paired bones that form part of the lateral walls of the nasal cavity. They're the largest of the three pairs of conchae. And, of course, the ethmoid bone forms the two other pairs. So you can kind of see here the nasal bone, the maxillary bone, and then the ethmoid bone with each of those conchae listed there with the frontal sinus. The hyoid bone is not a bone of the skull, and it lies anterior to the neck and inferior to the mandible. It's the only bone in the body that does not articulate directly with another bone, and it's anchored by ligaments. By the way, that's a good test question. But it acts as a movable base for the tongue and a site of attachment for muscles of swallowing and for speech. So this is that hyoid bone. Again, it is not a bone of the skull, but because of its location and its proximity to it, it's important to mention that here. The orbits, of course, these are cavities that encase the eyes and the lacrimal glands, the site of attachment for eye muscles, and it's formed by parts of 7 bones: the frontal, the sphenoid, the zygomatic, the maxilla, the palatine, the lacrimal, and the ethmoid. And so you can kind of see, here's what that photograph of that right orbit would look like on the skull. And here are those bones that form that orbit. So making sure that you're looking at this and understanding the location of each. The nasal cavity, that's formed by parts of several bones: the roof, which is a cribiform plate of ethmoid, the lateral walls, which are superior and middle conchae of the ethmoid, the perpendicular plates of the palatine, and the inferior of the nasal conchae. The space between the conchae are called the metasis, and the conchae increase the turbulence of the airflow that's there as it's coming in and out. The floor, that's the process of the palatine and the maxillary bone. And a nasal septum, that's that bony posterior formed by the vomer and perpendicular plate of the ethmoid. And so there's that bone of the nasal cavity, so making sure you're looking and understanding those. Different view of the bones of that nasal cavity as well. The paranasal sinuses, formed by 5 skull bones: frontal, sphenoid, ethmoid, and paired maxillary bones. They all contain mucosa-lined, air-filled spaces, and their functions with warm and they humidify the air. They help to lighten the skull and, of course, enhance resonance of the voice. And so you can see those paranasal sinuses and where those are located. The frontal sinus here, the ethmoidal air cells, or the sinus there, the sphenoidal sinus, and the maxillary sinus. And then looking at them from the medial aspect of each one of those sinuses, so making sure that you're understanding those. Moving away from the skull, I'll mention the stuff you need to know about the skeleton. Of course, there's general characteristics. It extends from the skull to the pelvis, also called the spine, or if we're talking about the vertebral column, it extends from the skull to the pelvis. It's also called the spine or the spinal column, and it basically functions to transmit weight of the trunk to the lower limbs, surround and protect the spinal cord. Its flexible curved structure contains 26 irregular bones called vertebrae and 5 major regions. These regions, 28-inch long vertebral column is broke down into 5 sections. This is the cervical, consists of 7 vertebrae, the thoracic 12, lumbar 5. If you want to remember, if there's a 7, 12, and 5 in the cervical, thoracic, and lumbar, remember meal times at 7 a.m., noon, and 5 p.m. That helps you remember how many bones are located in each. Just a handy little trick there. The sacrum, which is one bone formed by the fusion of several bones, which articulates with the hip, and the coccyx, which is also fused bones that form the terminus of that column. So the curvatures, the 4 main curvatures in the column help to increase resilience and flexibility of the spine. We have the cervical and lumbar curvatures, which are concave posteriorly, and then, of course, thoracic and sacral, which are convex posteriorly. So you can kind of see that vertebral column. You can see those sections of that, making sure that you're memorizing each one of those. Ligaments, along with trunk muscles, help support that vertebral column. Anterior and posterior longitudinal ligaments are continuous bands from neck to sacrum that run down the front and back of the spine. They support and prevent hyperextension backwards or hyperflexion forward bending. And the ligamentum flavum, which connects the adjacent vertebrae. So short ligaments connect each vertebrae to those above and below them. And so you can see that these ligaments are the fibrocartilage discs that unite that. So making sure that you're understanding this image as well. This, of course, posterior ligament here, and you can see this anterior longitudinal ligament that's there that helps that so that you don't overbend in either direction. The intervertebral discs are cushion-like pads sandwiched between vertebrae that act as shock absorbers. They're composed of 2 parts, the nucleus pulpus and then the annulus fibrosus. And so you can kind of see what that looks like here, making sure that you're reviewing and understanding that image as well. And here, of course, is that under an MRI so that you can see what that looks like, so that they're intact disc here, and here's a herniated disc, so you can see the differences between those. Making sure that you understand each of these vertebral structures and understanding the markings and the processes that are there. The vertebrae do have 7 processes: the spinous process, the transverse process 2, they project laterally, the superior articular process, which protrudes superiorly, and inferior articular process that protrude inferiorly. And so here is an animation. I'm not going to play it for this video, but if you go into your PowerPoints without this recording on them, you can listen to it, that one as well. The cervical vertebrae, C1 to C7, the smallest and lightest vertebrae. C3 to C7, they have an oval-shaped body. Exception is C7, which is a spinous process or split. We call it bifid. It's large triangle vertebral foramen. The transverse foramen is found to each transverse process for artery passages. And then the C7 is a vertebra prominens. It's large and can be felt through the skin. So it's actually used as a landmark to help find where the vertebral columns are. These are just the regional characteristics of the cervical, thoracic, and lumbar, so make sure you review that. This, of course, again, is looking at those regional characteristics from that chart before, so making sure that you're understanding and looking at the differences between those as you're kind of looking through. This is just a posterior lateral view of the articulated vertebrae, so you can kind of see what that looks like and where the C1 atlas. and the C2 axis is, so making sure that you're looking for there. And there's that protruding edge that you can feel, which is used as a marking in a locator. The cervical vertebrae, atlas C1, no body or spinous processes, consist of the anterior and posterior arches and two lateral masses. Superior surface of the lateral masses articulate with the occipitocondylates, and of course, they carry the skull. The movement is for like nodding the head, yes. And so you can kind of see that first and second cervical vertebrae there. And so making sure you're understanding the markings and processes on each one of those. The axis has body and process like other vertebrae. Its major feature is knob-like, so making sure that you're understanding and reviewing that and what that looks like on the bone as well. And of course, here's that posterior lateral view of that vertebrae too, as it looks. The thoracic vertebrae, T1 to T12, they increase in size and articulate with the ribs. They have unique characteristics. They're heart-shaped with two small demifacets that articulate with the ribs. T10 to T12 has only one single facet instead of two. The vertebral foramen is circular. They're long, sharp spinous processes. And so there's the review of those, so make sure you go over their regional characteristics and their structures so that you know them, including from different views as well. The lumbar vertebra, L1 to L5, is in the small of the back. It does receive the most stress. So the bodies of these are massive. They're short and thick. They flat and they're hatchet-shaped. And the vertebral foramen is triangular. So making sure that you go through and understand the regional characteristics of each of these and what they look like on the actual bones themselves. The sacrum is a triangular bone that shapes posterior wall of the pelvis. It's made from 5 fused vertebrae: the superior anticular process, the sacral promontory, the transverse ridges, the anterior sacral foramina, and the alae. The alae are just like the wing-like extensions. The sacrum, of course, has a median sacral crest, posterior sacral foramina, the sacral canal, and the sacral hiatus. And the coccyx is the tailbone, formed 3 to 5 fused vertebrae, articulates superiorly with the sacrum, and there's very little function to the coccyx. So that's the coccyx and where it's located and the different processes associated with those. The thoracic cage is composed of the thoracic vertebra posteriorly, sternum and the costal cartilages anteriorly, and the ribs laterally. Its function, it protects the vital organs of that thoracic cavity. It supports the shoulder girdles and upper limbs and provides attachment sites for the muscles of the neck, back, chest, and shoulders. And so that's the thoracic cage, making sure you are learning each one of those. It's also, the sternum is also called the breastbone, and it consists of 3 fused bones, the mandibulum, the body, and the xiphoid. It is not ossified till age 40, by the way, till about age 40. Oops. The sternum has 3 important anatomical landmarks you need to know: the jugular notch, it's the central indentation, the sternal angle, and the xiphosternal joint, where the sternal body and the xiphoid process fuses. And so that's the thoracic cage, the mid-sagittal section through the thorax, showing the relationship of these landmarks, and the vertebral column. When we're thinking about issues that can arise, the xiphoid process projects posteriorly in some people. So a blow to the chest can cause chest trauma at the level of the xiphoid process. It can push to the underlying heart or liver, and this can cause massive hemorrhaging. So during CPR, hands must be positioned mid-sternum to avoid breaking off the xiphoid process and damaging these underlying organs. The ribs, of course, there are 12 pairs that form the sides of the thoracic cage, all attached posteriorly to the bodies of the transverse process of the thoracic vertebrae. We have the true, the false, and the vertebral floating ribs. And so you could see, of course, those true and false ribs as they look on the rib cage. The ribs, so the main part, there's a shaft, which is a flat bone that has a costal groove to house the nerves and the vessels. And there's a head, which articulates with the facets, the demifacets on the bodies of the two adjacent vertebrae. The neck, which is constricted beyond the head, and the turbiculae, which is a knob-like structure lateral to the neck. And so basically it articulates posteriorly with transverse costal facet of the same numbered thoracic vertebra. So, of course, that's that structure of the rib. You see that shaft and the sternum as it's connected there. And then, of course, that angle of that rib there. So looking at that true rib there, make sure you understand each of these structures as you see them here. The skeleton itself is the next part. It consists of the bones of the limbs and their girdles, the pectoral girdle and the pelvic girdle. So the pectoral is the upper limbs to the body trunk. The pelvic is the lower limbs. The pectoral girdle, the shoulder girdle, consists of the clavicles anteriorly and the scapulae posteriorly. They attach the upper limbs to the axial skeleton, and they provide attachment sites for those muscles that move the upper limb, and they offer a degree of mobility. And so that's sort of the pectoral girdle with those articulating bones. The clavicle, we also call them the collarbones. They're S-shaped sternal end and articulates with the sternum medially. They're flattened acromal end that articulates laterally with the scapula. Here's the clavicle, making sure you understand what that looks like and can identify them and label them. The scapulae, they're the shoulder blades, so the thin triangular flat bones. Each scapula has three borders, the superior, the medial, and lateral, so making sure that you understand those. The scapulae, each scapula has three angles, the superior angle, lateral angle, and inferior angle. And the bone features of this, it has a spine, acromen, the coracoid process, and the supracapular notch. So there's several large fossae that's named according to their location. So do make sure you understand the processes and markings on these as well. The upper limb, 30 bones from the skeletal framework from each upper limb, the arm, the humerus, the forearm, the radius and ulna, and the hands, which has 8 carpal bones in the wrist, 5 metacarpal bones in the palm, and 14 phalanges in the fingers. So you can see that structure here, so making sure that you know all the markings and the articulation of the humerus. And, of course, here is that articulation at the elbow, making sure you understand each of the processes, markings, and so on. The radius and ulna are pictured here as well, making sure you understand each of those markings, processes, and can ID those. And, of course, this is the radius and ulna of the right forearm. These are the bones of the hand that you need to review as well. And the pelvis, making sure that you see each of those and can ID that. This is the hip bone or the coxal bones as well, making sure that you understand the structures and the processes and markings on those. And then, of course, the female true and false pelves, so making sure that you can see that. And then the comparison of the male and female pelvic area, of course, in the female, it is wider for childbirth, and male, it is more narrow. So looking at the differences between those and know the differences between those. And then, of course, the bones of the right knee and thigh, making sure you understand its structures and the processes on each one of those. The tibula and fibula of the right leg, making sure you understand the tibula and fibula, all the processes and markings that are found on those as well. Understanding the bones of the foot is also part of this process, so making sure you understand each of those that are there for that process. Also, it's important to know the differences between the skull of an adult and the skull of a newborn, so do look through those and those differences. Markings and plates that we see in the skull and noting those differences for those. You can see here that the different growth rates in the body parts do determine body proportions. You can see the newborn versus the human adult. Please let me know if you have any questions. I know this chapter was very different, but I just wanted to make sure that you knew what you need to go study and memorize. There's not much lecture that I can provide with, different parts, but if you have any questions, make sure to utilize the material, and please reach out. I'm always happy to help, and I'll see you in the next chapter.